My partner and I have been dispatched to the home of a 75-year-old male who's apparently fallen down the stairs. We have our BSI on. The scene is safe. Based on the scene, we only have one patient, and based on the fact that we found him at the bottom of the stairs and appears to be unconscious, we have a 55-year-old male with a mechanism of injury that I believe requires ALS. I'm going to ask my partner to take over C-spine so I can do my primary assessment. I'm going to start with the ABCs. I'm doing a modified jaw thrust with this patient. I'm listening and feeling. I see he does seem to have a pattern airway, but he is not breathing. I'm going to put an OPA in, which he accepts. I'm going to try suctioning and see if that airway improves. It does not, at which point I'm going to put him on a BVM with 10 to 15 liters per minute and assist in his breathing until such time as it comes back or we need further intubation. I'm checking circulation, both at the wrist and at the neck. He does have a good pulse, however, it's apparent he's in shock. His skin is cool, clammy, and his pulse rate is 30 and fast, at which point I'm going to try and get a sample history. Unfortunately, no one's around, so I cannot. I'm going to ask my other partner to go ahead and get me a set of vitals while I begin the secondary assessment. I'm starting off at the head. I'm looking for bumps, contusions, cracks, bleeding. I'm checking the ears for signs of CNS. I'm going to be checking the eyes and the face for crepitus and bruising. I'm going to go ahead and check his pupils to see if they are equal and reactive. I'm going to start down. I'm looking at the neck. I'm looking for JVD or tracheal deviation. I'm also going to check the cervical spine to see if there's any step flops or any injury. Starting with the shoulders, I'm looking for the shoulders and clavicles to see if they're broken or damaged. I'm going to check the chest wall, looking for flailed chest, broken ribs, etc. At this point, I'm going to auscultate the chest. I want to make sure that his breathing is adequate with us on a BVM. I do have breath sounds bilaterally. I'm going to be checking the abdomen. I'm checking all four quadrants. I'm looking for guarding, rigidity, tenderness. There appears none. Moving further down, I'm checking the hips, pressing in and down. There does not seem to be any deformity in the hips. Checking the leg, I'm looking for broken bones, any deformities, crepitus. I'm going to check CSMs. Obviously, it is unconscious, so all I can get is a good pulse in the leg. Checking the second leg. Again, no crepitus, no damage, good pulse. Starting up with the arm. Again, looking for bruising, broken bones, crepitus, and he's got a strong pulse. Checking the other arm and pulse. Patient appears to have no apparent injuries. There's no gross bleeds. While maintaining C-spine, I'm going to log the patient, roll the patient towards me. Just go ahead and roll. I'm checking the back, checking the spine, the scapulas. I'm checking for mud or blood. I don't see any. I'm going to roll the patient back. I've got a set of vitals from my partner, 90/60, pulse 110. I've got an unconscious patient, 55. I want immediate transport. Without a patient breathing, I want ALS to accompany us. I would start an IV to help with the shock. I'd use a 0.9% sodium solution and transport, and to help with the shock, I'd cover the patient with a blanket. And done.